Hello, my dear doctors. Welcome back. This is Dr. Azam here, your faculty of anatomy at PrepLadder. And now we're going to discuss all the questions of anatomy which has been asked in today's INI-CET exam. That is INI-CET May 2026. Let's see all the recall questions of anatomy. Of course, please omit the language of the question and options. This is just a recall session here. Later on, I'm going to upload all the exact questions along with the exact options there. Fine. So let's get started with the question number 1 here. The aponeurosis of the muscle highlighted in the providing image contributes to the formation of all of the following structure except which one? Now in this diagram, if you see here, this muscle, first of all, you should be able to identify this muscle here. Now this muscle that you are able to see in the image will be your external oblique muscle. This one will be the external oblique muscle. Now, how to identify the external oblique muscle? First, you can observe here that it is going to begin from the lower 8 ribs. The origin will be from the lower 8 ribs. And then the aponeurosis of this will be coming here and attaching onto the linea alba in the center. Fine. And you can actually identify that with the direction of the fibers. The direction of the fibers of external oblique will be exactly like you keep your hand inside the pocket. It will be like forward, downward, and towards the medial side. So therefore, we have come to the conclusion that this one here will be your external oblique muscle. Now it is asking this muscle here, it is going to form all of the following structure except which one here. So number one, inguinal ligament or the Pauper's ligament. Of course, that is actually a modification of external oblique aponeurosis only. So whatever this external oblique aponeurosis that you're able to see, the lowermost margin of this one will be becoming like more thicker, and that itself is nothing but the inguinal ligament or else the Pauper's ligament. Number two, superficial inguinal ring. Of course, that is also present in the aponeurosis of external oblique only. The triangle shaped superficial inguinal ring will be present in external oblique aponeurosis, whereas that oval shaped deep inguinal ring will be present in transversalis fascia. Conjoint tendon formation, no. External oblique is not involved in that conjoint tendon formation. Conjoint tendon is actually formed by the internal oblique aponeurosis along with the transversus abdominis aponeurosis. So internal oblique and transversus abdominis aponeurosis will converge together to form the conjoint tendon, not the external oblique. Anterior wall of the inguinal canal, of course, that is also contributed by external oblique. The anterior wall of the inguinal canal is formed by two layers. One is your external oblique, which is going to form the complete anterior wall, and even the internal oblique also, but only laterally. So whatever, remember that external oblique is going to form all of the following structure except which one here, except the conjoint tendon. So option C is the right answer here. Which of the following is the safety muscle of the larynx that is responsible for abduction of vocal cords? So one of the oldest question, and we have been discussing this n number of times, and I have given you a simple diagram also, like how to remember the safety muscle of the larynx. Now in this given diagram here, option A will be actually the posterior cricoarytenoid muscle. And that posterior cricoarytenoid muscle is going to pull the arytenoid cartilages away. And therefore what is going to happen? The vocal cord is going to move away. That is helping in abduction of the vocal cord. And once the vocal cords are abducted, your airway is going to remain patent. You'll be able to respire. That is the reason why it is referred to as the safety muscle of the larynx. So therefore, the correct answer here will be option A. Option A will be the posterior cricoarytenoid muscle. Apart from that, option B here, this one will be the lateral cricoarytenoid muscle. And option C here, that is between the thyroid cartilage and the arytenoid cartilage there. So therefore, it is thyroarytenoid muscle. And finally, option D here will be between the two arytenoid cartilages, and that will be the transverse arytenoid muscle. So the correct answer here, the safety muscle of larynx will be the posterior cricoarytenoid muscle, which is helping in abduction of the vocal cords, keeping the airway patent, open. Question number 3, which of the following muscles attaches to the membranous part of the Eustachian tube, that is your auditory tube, and also to the pharynx? Now there is a lot of controversy in this question there. Many of the students are recalling in different languages and also. Now, first of all, let me show you this image here. In this image, like many of the things will be very much clear. In this image, we are actually able to see the Eustachian tube here. The Eustachian tube, of course, it is having this bony portion there as well as the cartilaginous part there. Now, primarily attached to the Eustachian tube, you have to remember like 4 muscles here. Number 1, there will be tensor tympani muscle here. Number 2, there will be tensor veli palatini muscle here. Number 3 will be the tensor veli palatini, and number 3 will be levator valli palatini here, and then finally the salpingopharyngeus muscle here. Salpingopharyngeus muscle. Now, whatever feedback that I got here, it's given clearly in the question that the muscle is getting attached to eustachian tube and also to pharynx. The moment you see this word in the question, that's all. You are done with this one. Why? Because out of that 4 muscles that I told you, tensor valli palatini, levator valli palatini, salpingopharyngeus, and tensor tympani, out of the 4 muscles which I told you attached to the eustachian tube, please remember that salpingopharyngeus is the one which will be attached to the eustachian tube on one side, salpingo, auditory tube, and the pharyngeal wall on the other side. So when it is telling attached to the pharynx, your answer has to be the salpingopharyngeus. If this word is given there, if the language changes, if it is not attached to the pharynx, if some other option is given there, then the answer changes. But remember, primarily there are like 4 muscles which will be attached to the eustachian tube. I repeat again: tensor tympani, tensor valli palatini, levator valli palatini, and the salpingopharyngeus muscle. Now moving ahead with the next question, identify the histology image here. The image of histology was given here like this. We need to identify whether it is sublingual gland, parathyroid gland, liver, or the adrenal gland. Now, first of all, let us try to rule out the options here, my dear friends. Liver cannot be the answer here. The moment you look at the image, histology of the liver, clear cut, everyone knows that with that hexagonal lobules, the portal triad, central vein, hepatocytes arranged in the form of cords and all, liver is not the answer here. Adrenal gland cannot be the answer here. Why? Because in adrenal gland, you'll be able to see that in the cortex, there'll be that zones, the 3 zones of that, and after that, you'll be having adrenal medulla part also there. So there's nothing like zones or something like this in this image. So it cannot be the adrenal gland here. After that, parathyroid gland and sublingual gland, out of these 2, I can easily rule out parathyroid gland from here. Why? Because parathyroid gland, you cannot find this ductal system here. So you're able to see a duct here with that cuboidal or columnar cells inside that one, okay, with that basal nuclei. So you will not be able to see the duct inside the parathyroid gland. So we are going to omit that one. So the correct answer here will be the sublingual gland. Of course, it is sublingual gland. Why? Because in the sublingual salivary gland, you are able to see that you'll be having that mucus acini. You'll be having that acini, which are actually palely stained in the center there. So there is a pale staining with that, basal nuclei present over there. And of course, there is a even duct present over here. So therefore, my dear friends, in this manner, you can come to the correct answer, that is sublingual gland. Moving on to the next question, I think this was the easiest for you in your INI-CET exam today. Identify the histological image. Yes, of course, it is which corpuscle. The moment you see the arrangement there is like onion skin appearance. Onion skin rings appearance will be present there, and that will be seen in the Pacinian corpuscles. Moving ahead with the next one, hand and eye coordination is done by which lobe? Whether it is frontal lobe, occipital lobe, parietal lobe, and temporal lobe. We have learned about the Brodmann areas in detail. Now on the superolateral surface of the cerebrum, when you see in the parietal lobe, what is going to happen? There will be only and only one sulcus. If there is one sulcus here, of course, there will be like 2 gyri, one above and one below. Now this gyrus above here will be the superior parietal lobule. We don't call it as gyrus. Why? Because when the gyrus is like more larger, we call it as lobule. So it is superior parietal lobule. And in this, you'll be having area number 5 and area number 7, which will be the sensory association area. Now in this one below here, this will be the inferior parietal lobule. And inferior parietal lobule is the one which is responsible for hand and eye coordination. Hand and eye coordination is done by the parietal lobule. That to inferior parietal lobule, to be more specific. And remember, there's no number. The Brodmann areas are actually represented with numbers here, but inferior parietal lobule, only you have to remember the function. I told you many times in the classes, the function is hand and eye coordination. But remember, yes, there's no number given for that one, sir. Okay. Moving on to the next question. Match the following question was given. And in that, what happened is they have given like certain organs and then their related features were given. Now in this one, we haven't made like a table and all that matching and all. Directly, I have given you the matching. So in that table, the matching was given. The organ was given as esophagus. And esophagus matches with the epithelium lining there, the stratified squamous epithelium. And the Peyer's patches will be found in the ileum there. And duodenum is the one, the small intestine part, where you have the villi for, more absorption and all. And then transverse colon, the features of the large intestine, it will be having the tinea coli. So sometimes what will happen in your INI-CET exam, suddenly they'll be giving such a question that, it looks a very easy one. So always will be having the habit of going for like extreme things and, difficult things and all. But it's like very easy one. It's almost like first year MBBS knowledge. Like just the features of the organs with them, with their organs, we need to correlate them. We need to match them. And it was like one of the easiest question over here. And by this, my dear friends, we are done with all the MCQs, all the questions which has been asked from anatomy in the INI-CET May 2026. If any of the questions are left out here, please feel free to, update me or message me. I'll be happy to include them over here. And apart from that, we'll be, of course, coming up with the exact questions, exact options, everything completely very soon. Thank you. All the best.